Neuropathy. It's a debilitating condition, but it's one we take care of here on a daily basis. If you look at peripheral neuropathy, which is basically numbness and tingling in the hands and the feet and nerve damage due to a variety of causes, really the old way and what's called the standard of care, unfortunately from the American Medical Association, is number one, to put you on medications, things like gabapentin, Lyrica, Neurontin. And those medications were actually originally designed to be anti-epileptic and seizure medications. So they don't actually heal the tissue and they don't do anything to stop the progression of the disease. What they do is they basically stop the signaling of the damaged, dying tissue to the brain. So you pay less attention to it and you care less about it. Your symptoms are effectively being managed while the disease continues to progress. With that disease progression, there's really no end in sight or a solution to get you off those medications or to solve the underlying disease process. And over years, that condition is going to get worse. The next step after medication is to give you walking assisted devices, a cane, a walker, and sometimes they'll result in venous or arterial ablations or nerve ablations. But again, the condition is getting progressively worse. The greatest fear with peripheral neuropathy is eventually amputation. That is the standard of care for peripheral neuropathy sufferers in our country. It's so unfortunate. I don't know about you, but I would want a different solution, which is why we do what we do here at True Roots. When you go down this old route, oftentimes you're left with unanswered questions and you're left to do your own research. And the two primary questions that we typically hear is where did this come from and what's causing it? Well, what we know is with peripheral neuropathy, there's a loss of blood flow, typically the small blood vessels, either because you're dealing with diabetic or pre-diabetic, or you went through chemotherapy. Those small blood vessels have broken down, and the nerve tissue isn't getting the blood and oxygen or the environment that it needs to continue to function. Nerves are the primary tissue in the body that helps your brain tell everything what to do and how to do it and to keep it alive. At our office, what we do is we look at the underlying circulatory health of your system to see if the blood vessels are getting enough blood and oxygen to those nerves. So what we would like to do is invite you into our practice. So feel free to check out our website, look at our testimonials, look at our reviews, see the success that other people have had. If this interests you or you want to learn more or have a personalized assessment, feel free to fill out the form below, give us a call, and we'd be happy to set you up for an initial evaluation here in our practice. What that's going to look like is when you come into the practice, we're going to sit down with you and go over your detailed health history to understand where this all started from. And we're going to take you through an exam process. The exam process is going to allow us to look into how well that circulatory system is functioning. If those small blood vessels in the feet are damaged and not providing the oxygen needed to that nerve tissue. We'll pair that with the Toronto Clinical Scoring Assessment, which is a gold standard way for us to evaluate how much nerve damage is actually there in your feet or in your hands. After we assess the nerve function and the circulatory function, we do know that 60% of peripheral neuropathy sufferers typically have some variation of spinal damage or spinal-related disease. Maybe they're post-surgical, maybe they had an old injury. So we're going to assess you as a whole person. We're going to do a radiographic evaluation of your spine to see if there's any underlying complicating issues there, and we are capable of addressing those as well. After we go through that very detailed examination and comprehensive exam process, what we're going to do as a team of docs is sit down and review that data. We're going to invite you back for a follow-up visit. So we're going to sit down with you one-on-one to review your case and your findings. So that way you can have objective understanding of where you're at in this disease process and what it's going to take to get that tissue back to healthy. And usually there's 3 factors that help us to regenerate and regrow that tissue and repair that nerve damage. One is we have to give the body the nutrients that it needs in order to repair tissue. If you're a gardener, think of if your plants aren't bearing fruit anymore. And one of the first things you need to look at is the content and the quality of the soil. Most of the time we would want to put fertilizer in the soil. So for you, we need to put fertilizer in your body to give your body the nutrients that it needs to repair tissue. Secondarily, we need to increase blood flow and oxygenation to those tissues, which we typically do with a device like red light therapy or with soft wave therapy here in the practice to stimulate something called angiogenesis or the regrowth of those blood vessels. Once we have the nutrients in the blood going to the right area, then we need to increase the cellular signaling of that nerve tissue, which we do with a peripheral nerve stimulator. This device is called a rebuilder, and it's used in the Cancer Treatment Centers of America in order to help people deal with their chemotherapy-induced neuropathy. When we pair that comprehensive approach together, we're addressing the underlying nutritional deficiencies, the vascular deficiencies, and the neurologic damage, And that's the magic formula for helping you to restore that nerve function. Our family so looks forward to partnering with yours to get to the root cause of your health concerns so that way you can get back to living a life of independence and medical freedom.